then. Fabi, can you begin recording, please?
Yes, we have started to record.
Brilliant, thank you. All right, welcome again, everyone, to our monthly March module, or monthly module for March. Today's training topic is care coordination for open card or fee-for-service members, FFS. My name is Dina Mar. I'm a regional outreach coordinator with the Community Partner Outreach Program, serving Hood River, Wasco, Gillum, and Sherman counties. And today's webinar is being recorded. We will begin with the presentation and then allow ample time once the presentation is done for questions. And Fabi, would you like to introduce yourself?
Yes, absolutely. Good morning, everyone. I'm Fabiola Herrera. I'm also Regional Outreach Coordinator with the SIPO program, and I am serving the Willamette Valley region, so Marion, Polk, and Jam Hill counties. Thank you.
Thank you, Fabi. And also my colleague Jessica here. Jessica, can you introduce yourself, please?
Hi, everyone. Jessica Diaz here, the statewide provider outreach and engagement strategist for the team, and happy to be the bonus extra CPOP member here to support you today.
Awesome. Thank you, team. All right. So care coordination for open card fee for service. Today, we are going to cover OHP care coordination, Oregon Health Plan care coordination, excuse me, and what is included, what are coordinated care organizations, and who are the main contacts, what is open card or fee for service, and the care coordination pathways for open card members, and what is included, including the 3 pathways listed, Client Services Unit, Care Oregon for tribal members, and KEPRO. We'll also provide some additional resources and contacts, and of course, leave time for questions. All right. So OHP, Oregon Health Plan Care Coordination, is a service that gives our Oregon Health Plan members education, support, and community resources to assist with working on their health within the healthcare system. It is organized coordination with providers and anyone involved in a member's healthcare services. It is also a covered benefit for all OHP members, including Coordinated Care Organization, CCO, and Open Card members. As you can see, there are 2 links on the slide here, the OHP Handbook and the Quick Start Guide. I should have started by letting you know that in the attachments here, or handouts, excuse me, the presentation is there in PDF format. So all of these links will be available to you there if you download it. And I'll also be emailing you with a follow-up to include the attachments and any links. And Fabi, if you're able, yep, thank you, way ahead of me. So Fabi has also included the links for these, for the OHP Handbook and Quick Start Guide in the chat for your reference. So just to quickly kind of sum up OHP care coordination, essentially care coordination helps our members attain and maintain good health without having them go to different places that aren't talking to each other. And that way there's a team of people here to support them. A good example of this would be if someone is experiencing tooth pain. We know that oral health can have an effect on the rest of our health. So it's important that there is communication and coordination between our medical and dental providers. So moving on, some examples of what is included in care coordination. So this slide really, it just shows a big picture idea of different pieces of care coordination that coordinated care organizations or CCOs follow. And this includes appointment scheduling, referrals to specialists, access to community health workers and personal health navigators, supplies such as medication, durable medical equipment like wheelchairs, diabetic supplies, oxygen tanks, as well as medical, vision, and dental needs, mental health and addictions treatment, social service referrals for SNAP, so Supplemental Nutritional Assistance Program, or food stamps, housing, transportation, as well as additional resources and education for weight and chronic disease management, diabetes classes, and smoking cessation. I really like this diagram here we're looking at. It shows the before and the after in accessing care coordination. So it shows how unclear or scattered it may be for our members before they call or before they get access to care coordinators who can help them get things in order or organized. So they might not know how to get a wheelchair, how to find a dentist, how to make an appointment, for example, and care coordinators can help them learn about their needs and find solutions, make sure the providers are talking to each other, help with additional services, resources, education, etc. All right, so I said coordinated care organizations many times, or CCOs. So let's dive into that a little bit. So what are they? In Oregon, we use CCOs to help us manage our OHP members' healthcare needs. There are multiple CCOs responsible for coordinating care within specific areas. And a CCO essentially has a group of providers, including doctors, counselors, and dentists who work together to keep our members healthy. So instead of just treating members when they get sick, CCOs are responsible for working with members to keep them healthy. Just an additional note here, the CCO model follows Oregon's Medicaid model, in which local CCOs have one budget for all types of care and are accountable for the health outcomes of the populations they serve. So each CCO has a care coordination team that offers member support services, and members and or CPs can contact the CCO customer services to be referred to these teams. And some CCOs have the member services contact listed on our members' member ID cards, and we'll talk more about this here shortly. I'm sure many of you have seen this map if you've taken our trainings. So coordinated care organization service areas. So most OHP members are enrolled in a local provider network called a CCO, and there are 15 organizations that OHA signed new contracts with in 2019 to serve as coordinated care organizations for our OHP members. And you may be familiar with many of these or some of these depending on the areas that you work in or serve community in. And some members may have the option of more than one CCO, while others would only have one. Now about that member ID card we talked about. So we said community partners can refer members to care coordination by contacting the member's CCO. And oftentimes members are also referred to care coordination by a RN case manager or their provider office or a community-based organization. They can also self-refer or request care coordination on their own by contacting their CCO. So their member services card or ID card here includes these contacts for them as well, as well as other important information such as dental plans and contacts, primary care providers, mental health, substance use plans, urgent care contacts. So these are just a few examples. Like we said, there's 15 different CCOs across the state. These are just 3 examples of that you might be familiar with: Jackson Care Connect, Health Share of Oregon, and Trillium, and they're all different in how they present their information. So here you can see it's member and provider customer service. This is where a member or CP can call for referral to care coordination or member support services. Whereas Health Share of Oregon has a general number here, and I believe this is the customer service. But like we said, it also includes additional information: pharmacy provider, the dental plan, the primary care, physical health. Here for Trillium, on the back of the card, it has a direct link that's highlighted for the member services team, as well as medical transportation management. So each card is unique based on the CCO, but we really highly encourage our members and our CPs to look to this for reference when trying to access care coordination. There's a link here. For the sake of time, I'm not going to go to it, but like I said, it's included in the PDF, which I'll also send to you. And I believe that Fabi already put it in the chat because she is way ahead of me, but it's pretty great. It gives you a list of different coordinated care organizations, all the different coordinated care organization contacts, as well as their websites, including their member handbooks and provider directories. So it's a nice resource to have. All right. So depending on a member's coverage, care coordination is accessed in different ways, right? So we talked about what that looks like for CCO members, and now we're going to talk more about open card or fee-for-service members and the different pathways for accessing care coordination for these members. So as you can see on the slide, 90% of OHP members are on CCOs, while only about 10% are on open card fee-for-service. Please take these numbers with a grain of salt. This is the most recent information we have. It may have changed slightly, but just so you get an idea of the difference in how many members are enrolled in which. So what is open card or fee-for-service? So under open card, Oregon Health Authority pays each provider a fee for the covered services that members receive. So new OHP members, and most of you probably know this already, but new OHP members are on open card for about 2 weeks before they become enrolled in a CCO. Some members are not eligible for CCO and have to remain on open card. And some members have the option or right to remain on open card if they choose to. So this model follows a traditional healthcare payment model, where providers are paid directly and it's not managed by a CCO that manages a network. So those on open card do not have a CCO coordinating their care. And something to note here is, and that we get questions on, is when a member receives services as a fee-for-service member, this does not mean that they pay for the service. So I just want to highlight that. The member has zero responsibility here. Excuse me. All right. So if someone has other major medical coverage like employer insurance, commercial insurance, workman's compensation, or COBRA, so rollover insurance they're paying for after leaving an employer, OHP is always going to be billed secondary to that coverage and isn't going to be coordinated by a CCO. So they will be on open card fee-for-service if they have third-party liability or other major medical. So they're not eligible for CCO. Other members who are not eligible for CCO are those on COWM Plus, or Citizenship Waived Medical. So this is emergency care available for people who do not have a qualifying immigration status. This is also billed fee-for-service. So when someone is pregnant, they can get COWM Plus, which grants them full benefits for the duration of pregnancy and 2 months after. Also fee-for-service. And just to go over COWM a little bit more, COWM and COWM Plus are also known as Citizen Waived Medical, and are programs available to residents who don't have a qualifying immigration status. At this time, someone on emergency COWM or pregnancy COWM Plus is only eligible for open card coverage and will not have a CCO, just to emphasize. Okay. And then we have members who may be enrolled with a CCO or remain on open card, so they have special enrollment rights and conditions. And that would be newly eligible pregnant women in the 3rd trimester. They can opt out of CCO. Dual Medicare, Medicaid members can opt out of physical health enrollment with a CCO. And Heritage Native American members are also exempt from CCO enrollment, but they can enroll in CCOs if they would like, as well as Oregon Youth Authority and child welfare members or medically fragile children may also be opted out of CCO enrollment. So the following categories or populations, members, have the rights and conditions or conditions that allow them to opt out of CCO and remain on open card. So how do they get care coordination? So there are three different pathways for care coordination for open card or fee-for-service members. So the CSU, or Customer Service Unit, I want to really highlight here that it is not just for open card. It is for both CCO and open card members. It offers basic or limited services for all members. And then there is Care Oregon for tribal members and KeyPro for all open card members. And we'll go into each of these here. So the Client Services Unit is the first place that open card members should go if they have bills they don't understand or other needs or complaints about getting access to care. It doesn't offer full-blown care coordination, but if a member does not have intensive care needs or intensive needs, excuse me, they may be able to get their questions answered through CSU. And so OHP members and certified community partners can work directly with the Client Services Unit to do the following: change CCO enrollments and answer questions about CCOs, handle requests to be on open card for continuity of medical care, provide general information about OHP medical, dental, and mental health benefits, help share knowledge with members on how to access or use OHP benefits once the benefits are active. The phone numbers here, I'm sure you're all familiar with it, but it will be included in the slides for your reference. So the CSU, please note that the CSU cannot make any eligibility changes to a member's case, such as address changes or adding or removing household members. The CSU will transfer a member or a community partner to an eligibility worker for this, if that's the need that we're calling about. Okay. So that was the first pathway, the Customer Services Unit, for more basic assistance. And then there is Care Oregon for tribal care members, or tribal care coordination, excuse me, for those who are self-identified American Indian or Alaska Native members who are on open card, because remember, they have the option to request CCOs as well. So they can call Care Oregon directly. Care Oregon has a tribal care coordination team. There's a toll-free number, a local number, as well as a TTY number. And they can also access or contact the 24-hour nurse advice line. There's a link here for more information to the Care Oregon website, specifically under for members, tribal members and tribal care coordination, that we'll put here in the chat in a bit. All right. And just a little more on tribal care coordination services. This is what Care Oregon highlights as their strength. So we talked earlier about the benefits of care coordination, which apply to any and all Medicaid OHP members, but each entity highlights their strengths or words it in a different way. And Care Oregon includes care management for diabetes, heart failure, asthma, depression, substance use, including drugs, alcohol, or tobacco. They also offer intensive care management for those with multiple chronic conditions, special healthcare needs, or those who have a disability. Something to note is Oregon has 9 federally recognized tribes. My advice is, even if you are working with a member whose tribe isn't listed or is from out of state, please still refer the member in need to tribal care coordination. The tribes communicate with one another and find a way to address tribal member needs. All right, and so that was the second pathway for open card members who are tribal. And then there's the third pathway, open card fee-for-service care coordination through KeyPro. So KeyPro works on behalf of Oregon Health Authority to offer the Oregon Health Plan Care Coordination, or OHPCC program, at no cost to all open card members. It also includes a nurse advice line, which is sometimes referred to as the OHP Care Coordination line. Their website includes a provider database search, and we'll include that in the chat. Tribal members, by the way, tribal members can reach out to KeyPro, but will likely be connected to Care Oregon, as that is the appropriate specialized team to serve them. The nurse advice line is also has a Spanish option, and of course there's other languages upon request. Oh, and Fabi already put the link for you in the chat. Thank you, Fabi. Okay, and a little more on KeyPro. So there's 3 ways to access care coordination through KeyPro. Members can call the 24-hour nurse advice line, where they can ask for assistance to help manage conditions, illnesses, diseases. They can talk to a nurse at any time about their health, about their health and where to access care. And they can find a doctor or other healthcare provider Monday through Friday, 8 to 6. But the nurse advice line is 24 hours. Another way is members can be referred by their providers through member-related communications at this email here. And members can also self-refer themselves using an online member self-referral tool. So the care coordination team with KeyPro assesses and discusses how best to assist members on an individual basis. And this can range from care coordination to intensive case management, depending on each individual case. And like Care Oregon, KeyPro has highlighted their strengths in terms of the care coordination services that they provide, which include thorough assessments of member health, living situation, and support system, a plan of care consistent with their provider's care, assisting members with medication compliance, exercise, diet, appointments, education, disease management, tobacco cessation, a hepatitis C program. Also, there's resource assistance to members in need of community or state assistance program, i.e. transportation, help with utilities, or finding a doctor or specialist. And their case managers do assist members regardless of which county or area in Oregon they reside. All right, so now that we've gone through our main objectives in terms of care coordination, CCOs, fee-for-service, the different pathways to access care coordination for open card fee-for-service, we're going to talk about a few additional resources or contacts. Okay, so open card fee-for-service members can start with, like we said, can start with the CSU or customer service unit, excuse me, first, but it's important to know that they may refer to KeyPro depending on their need or requests, or they may be referred, excuse me, to KeyPro depending on the need or request. So members can also call KeyPro first. The KeyPro number is not on their member ID card. The CSU phone number is what is on the back of the cards. And open card members will receive a paper printout with multiple copies of this ID card. There is no laminated or hard card version. If an ID card is lost, eligibility workers can print an additional card at an ODHS office, or members can also call the CSU for replacements. So again, the KeyPro number isn't on here, but the customer service unit is. Members can contact us for referral to KeyPro if they're needing care coordination that's a little more intensive than what CSU can help with. And you as the CPs obviously can also refer members directly to KeyPro through the website and through the nurse advice lines. Okay, another resource we want to talk about is non-emergent medical transportation. So non-emergent medical transportation is a covered OHP benefit that pays for members to travel to OHP covered healthcare services. So open card members can contact KeyPro. They can also call their ride service, which is MedLink. It's MedLink across the state, but they have different phone numbers for depending on the region. All of that is accessible here at the Oregon Health Authority's NEMT handout website. And then CCO members can contact their CCOs directly, or they can contact their local ride service, which is also available here. So all contacts and information for both the CCO and open card members is available at OHA's non-emergent medical transportation handout website. There's also a brokerage map that shows the service providers essentially for non-emergent medical transportation based on region. And they're pretty, well, that's arbitrary. In my opinion, they're user-friendly. Obviously, if you have any difficulties with it, please reach out. So a few things to note about non-emergent medical transportation is it usually includes travel by taxi, bus, or local ride service. In some cases, OHP may pay for travel costs like gas, meals, or lodging if approved by the member service, ride service before an appointment. And then tribal members are eligible for non-emergent medical transportation, and they're also eligible for it to tribal health service appointments. And then unfortunately, CALA members do not qualify for non-emergent medical transportation. And then I see Fabi already included these 2 links for you in the chat as well. Thank you, Fabi. All right, I think we're right on track and we're moving into questions. So please, if you, or actually, let me ask Jessica or Fabi, is there anything I missed or anything you wanted to add or talk about before we dive into questions?
No, from my end, Dina, not that I can recall. This is Fabi.
Thank you, Fabi.
Yeah. Great job, Dina.
Oh, thank you, Jess. All right. So community partners, attendees with us today, please let us know if you have questions. You can use the questions box. And I think, and forgive me, I'm going to have to defer to my colleagues for technical assistance on this. If we can unmute, if you prefer to be unmuted, we can do that as well. And I'll give it a minute or so for people to type if questions come to them.
You did such a good job explaining that there are no follow-up questions.
Either that or their heads are swimming. I'm not sure. Well, I'll give it a couple minutes. But if you don't have questions and you got everything you need from the presentation, feel free to gracefully exit the webinar. Again, I'll be sending a follow-up to all attendees with the attachments and links. All right, thank you, everybody. Thanks for joining us today.
Thank you, Dina and Fabi.